This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program, Mon Health Talk. I'm Dave Wilson, and February, of course, marks the start of Heart Health Month. And all month long, we'll be talking about heart health. Joining us today, Dr. Bradford Warden, Interventional Cardiologist, Executive Director of Mon Health Heart and Vascular Center. Good morning, Dr. Warden.
Good morning. How are you?
I'm doing great. We're going to be talking about advancements in heart care as the day goes on. But before we get started, let's start with you. I know this is always awkward to talk about yourself, but we're going to talk about you for a minute or two. Tell us a little bit about your background, where you grew up, where you came from, and how you ended up with Mon Health.
I am one of the rare breeds. I am from Morgantown originally. My father was a doctor here in town, and so I grew up in Morgantown. Went away to college to Washington Jefferson College, then worked at Milan for several years, and then came back and went to medical school here. And now I'm over at Mon Health.
What got you into cardiology?
Well, I was looking for a profession where there was going to be a lot of demand, number one. I wanted to use both my hands, but also treat people, with medications and so forth. So some procedural parts of it, but also medical therapy, and cardiology was a good outlet for that. And there's a lot of movement in cardiology towards procedures. Instead of doing open procedures, doing procedures with catheters, et cetera.
Yeah, and that's what we're going to get into today. A lot of people, and we talk about this with a lot of procedures, folks still have that idea in their head of maybe 25, 30 years ago of what a surgery, an operation, or procedure was then. A lot has changed. It's a lot more minimally invasive when possible. A lot of procedures, hospital stays are much shorter than they used to be. We'll get into all of that, but I mentioned February is Heart Month. And we're going to be talking about heart and vascular systems for the next couple of weeks here on the show. But when we talk about West Virginia specifically, Dr. Warden, how prevalent is heart disease and really how big of a problem is it here in the Mountain State?
Well, it is the number one killer in the state of West Virginia, and that is for men and women. There's a lot of publicity out there, and certainly very important for women to get checkups, breast exams, cervical screening, et cetera. But it turns out that actually heart disease is the number one killer. There's over 600,000 people a year that die from heart disease in the United States. In West Virginia, it's especially prevalent because of our demographics. I mean, who lives here? So our population on average is a little bit older. We usually vie with Mississippi and Alabama for the number one in obesity, and what comes along with obesity is diabetes. So people tend to be heavier. They're more diabetics, and believe it or not, 25% of the state still smokes. That is a very high number, and again, we compete with those other states, southern states, for number one as far as smoking. So a lot of habits, a lot of the way that we were raised, because a lot of people in West Virginia, are steak and potatoes people. They still, follow, and a lot of times you follow what your parents did as far as diets and so forth, because that's what you're used to.
Well, one thing I've found with that little caveat when folks will tell me, Granny used to cook everything in bacon grease, and but also Granny and Granddad probably worked 9, 10, 12 hours a day, manual labor outside. Granny wasn't cooking everything in bacon grease and then sitting on the couch or sitting at a desk for 9 or 10 or 12 hours a day. So, I'll throw that little tidbit in there because there might be a little bit difference in lifestyle. But
well, absolutely. My mother grew up on a farm, and her mother prepared meals for her husband and the workmen for the noon meal. They had 2 meats, several different starches, and so forth. But they were working 12-hour days, and back then a lot of even those kind of professions like farming, et cetera, have changed a lot with a lot of things becoming automated. Back then, I still see pictures. My mom will show me of her brothers and so forth driving teams of horses and so forth to do different work on the farm, and a lot of stuff by hand. And now things are so much more automated that you're right. We don't burn the kind of calories that our grandparents and great grandparents, burned, and they still had decent BMIs, like that's body mass index. That tells you like how heavy a person is based on their weight and their height. And a lot of times when you think back about grandparents, they were still fairly slender, But as we eat more processed foods, more sugars, and so forth, now there's a lot more obesity.
Coming up on the other side of the break, we'll talk about treatments. But before we take the break, it's always easier to prevent an issue than to come back and treat it after the fact. And actually, when it comes to heart disease, the prevention steps are probably easier said than done, but they're pretty simple.
Yeah. The first thing, number one, for West Virginia is probably we need to get people to quit smoking. That is a very difficult process. Again, the cigarettes are manufactured to keep people hooked. It's not like it was in the old days where there's just the natural amount of nicotine and so forth. They are supercharged with nicotine, and that keeps people physically. And then there's an emotional side to smoking. So I could just play the recording, for 100 different people, but they said, I quit smoking, I didn't smoke for a whole year, and then they hit some sort of a hardship in life. Somebody lost a job, somebody passed away, some financial troubles, et cetera, and they just said, I just was going to have one cigarette, and so forth, and then they started back into the smoking. So quitting smoking would be high on the priority list. Diet, like we talked about earlier. Exercise, they're recommending 150 minutes of exercise. Most people would do that in 30-minute blocks, 5 days a week. And then if you have certain diseases before you get heart disease, if you have diabetes, you should be treated. You should know what your numbers look like. If you have high cholesterol, you should be treated, and high blood pressure. So those are a lot of the identifiable. Some of it's genetics, and we can't do much about genetics, at least yet. But, so you can't do much about that, but there are lots of things we can do to slant things in our favor.
Talking to Dr. Bradford Warden this morning, Interventional Cardiologist, Executive Director of Mon Health Heart and Vascular Center. We'll talk about some of the advancements in treating heart disease right after this. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Dr. Bradford Warden is our guest this morning, Interventional Cardiologist, Executive Director of Mon Health Heart and Vascular Center. What are some of the advancements that have been made in our region when it comes to treating heart disease?
Multiple, and not only just the advancements, but also in the further advancements, the way we actually do those procedures now. Things like, it was like I mentioned, my father was actually a heart surgeon here in Morgantown. So before, the only way to replace a heart valve was to actually have your chest opened and the surgery done to replace the valve. And now the aortic valve can be replaced normally from the arteries in the leg. The recovery time used to talk about weeks and months. and now people are going home the same day or the day after those procedures and feel remarkably better, just in a very short period of time because, again, they're minimally invasive. We can help with if the mitral valve is leaking. There's a technology called MitraClip. It actually attaches two leaflets of the valve together. That can also be done with a catheter, avoiding having to have an open heart procedure. For atrial fibrillation, there's a great device called the Watchman Flex device. That's a device that goes inside the heart tissue, blocks off the area where most blood clots come from, and we can get people off of their blood thinners that's normally required for people with atrial fibrillation. So if you're having trouble with bleeding and so forth, but you still have atrial fibrillation, those are other technologies. But we're doing all of those things now, not only minimally invasively, but also with just moderate sedation. When those procedures originally started, they were done under general anesthesia. And again, people have problem with general anesthesia. Some people have problems with nausea, et cetera. Normally takes a while for them to recuperate from that. Now, just with twilight sedation, we can do those procedures. We get people home and back to their families, a lot more quickly and safely. We like to, we certainly love having patients here in the hospital, but we know that they're, safer from infection and those sorts of things if they're at home. So the less amount of time you spend in the hospital, the better.
A phrase that certainly will catch everyone's attention, open heart surgery. That seems like it is a last resort option. Is that an accurate description? And are you moving away from trying to do those procedures as often or as infrequently as possible? Where are we as far as actually the major procedure where you go in and may have to stay in the hospital a few days?
Yeah, a great majority of the time we can fix blockages in arteries using catheters and stents. There are, a minor part of the population that is best served by having bypass surgery. But the statistics over the course, since the technology of stents has changed quite a bit over the last, sort of 20, 30 years. We now have medicated stents that stop blockages from coming back within the stents, which was, whenever you put a piece of metal inside of an artery, there's a reaction from the artery. And a lot of times scar tissue would grow back to the center of the artery and block the artery off. Now with medicated stents, we don't have the incidence of that is very low. And so we can use stents to do that. And, a lot of people, some places still use a lot of bypass surgery. We're in a position where, if you need bypass surgery, that's the best choice. That's great. But most of the time it can be done with a catheter and with stents. And if you're being considered for bypass surgery, we would certainly be happy to give you a second opinion on whether we think that it would be possible to treat you, with other methods.
Talking to Dr. Bradford Warden, Interventional Cardiologist, Executive Director of Mon Health Heart and Vascular Center. We'll continue the conversation and wrap it up when we return right after this. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Got a couple of minutes left here with Dr. Bradford Warden, Interventional Cardiologist, Executive Director of Mon Health Heart and Vascular Center. You talked about AFib just a little bit ago, but Mon Health is AFib accredited and the only hospital in West Virginia, 24th in the country, by the way, to have a heart care center. So if I'm the patient, what do I make of these accreditations and recognitions?
Well, I think that anybody can say anything about themselves, but it's different when you ask somebody to come in from the outside to do an objective evaluation, which is what these things represent. The Heart Care Center, you have to be accredited in a couple of different subgroups of cardiology. Atrial fib is one of them. We're also accredited in chest pain. And then we applied for the heart care center. And again, they look at your quality numbers. They look at your protocols for treating patients. They look at your outcomes and so forth. And then they do an objective analysis to make sure that you're worthy of those accreditations. So we're very proud of those things, but we're proud of those things as a result of a lot of just great care. And, we think more importantly, it's how the patients feel. We're still a patient-centered, place to get care. And there was a healthcare leader in Pittsburgh that said there's not enough care in healthcare anymore. And we know our niche. We know that's what people come to us for. We want them to get the best care, high-tech care, but in an environment that's friendly for both them and the families.
Got less than a minute here, but we've touched on several procedures, both the major variety and minimally invasive. For folks who want to know more about the Heart and Vascular Center, what kind of procedures are offered, or to get in contact with you or one of the doctors there, how might they go about doing that?
We have a website, monhealth.com/heart would be one way to do that online. Real important is for patients to be followed up by their primary care physicians, because they're the ones a lot of times that are helping them down the road, to a healthier lifestyle with a lot of the care for their sugars, diabetes, and the cholesterol, high blood pressure, et cetera. But then, most of the people are referred in by their primary care doctor, or the patients themselves can call in to Mon Health and get an appointment. So, we're available 24/7. Obviously, we get a lot of people that come in through the emergency department.
Dr. Warden, we got to leave it there. We're coming up on the top of the hour. Great information.